Fantastic. It's my pleasure to introduce Professor Jonggi Choi, who's assistant professor in the Department of Gastroenterology, Liver Center, Asan Medical Center, University of Ulsan College of Medicine in Seoul. Professor Choi.
Do you see my slide?
Yes, if you can just put it in presenter mode. Perfect.
Excellent, perfect.
Okay, great. I'm Jonggi Choi from Asan Medical Center, Seoul, Korea. Thank you for having me on this great webinar session. For the next 10 minutes, I'm going to talk about the status of the hepatitis C elimination program in Korea, mostly focusing on recent policy and then some updates for the HCV care cascade improvement. I'll start with this graph indicating where we are in the journey of HCV elimination. In Korea, among the target goals by the WHO, reducing mortality has been already achieved. Treatment rate is expected to be achieved by 2030. However, the problem lies in the underdiagnosis and the lowering the incidence. In Korea, the anti-HCV positivity prevalence is estimated about 0.7 or 6%. However, as all of you know, HBV is still a major cause of chronic liver disease in Korea. Therefore, many attention for viral hepatitis have been focused on HBV rather than HCV. In Korea, as I showed you earlier, prevention of new infection is still lower than we planned, whereas the decreasing mortality has already met goal we planned. This is the fact sheet for HCV in Korea published 2 years ago. I'm sorry about the Korean on this slide. However, you can probably understand what the numbers indicate on this slide. In 2019, there were a total of 8,810 HCV infection patients. Of these patients, about 78% just visited at least 2 times for HCV infection. Then 74% of them were treated with antiviral treatment. In total, about 58% of patients with HCV infection were estimated to be treated with antiviral agent. These are core indicators relating to the HCV care cascade in Korea. About 6,000 patients were newly diagnosed with HCV infection in every year, and treatment uptake rate ranges around 53% to sometimes 60%. To enhance awareness of HCV infection, our CASL, Korean Association for the Study of the Liver, we advertise to Korean people through the media multiple times. The content of this campaign includes what is HCV, what HCV causes, why do we need the HCV screening. Another effort from our Liver Society is that we also advertise the importance of HCC care to the doctors in private care setting and even dentists. We made leaflets, flyers, or sometimes we provided a poster to them, and then they can hang the poster in their clinic to increase the awareness for their patients. In 2020, we launched a pilot program for national screening for HCV to the general population. For those born in 1964, anti-HCV testing was free by this pilot program. The participation rate was 78%, higher in female. Anti-HCV positivity was 0.75%. And interestingly, only 6% of people participated in this program have been tested for HCV before. The treatment rate after HCV diagnosis was 70%. Based on this pilot program and many previous studies done in Korea, a cost-effective analysis has been published. indicating universal one-time HCV screening for general Korean population can be cost-effective if anti-HCV prevalence is more than 0.2%. And as I mentioned earlier, the prevalence of anti-HCV positivity in Korea is about 0.6%. Korean Liver Society discussed many times with our government to launch this one-time universal screening program, especially to be adopted as one of the components in national regular health checkup. And for the next few minutes, I will discuss about what we are doing in a hospital level to improve HCV care, especially increasing HCV testing rate. This is a summary of a study we published last year. Actually, this study was done in a hospital where I'm working now. We analyzed HCV care cascade in a tertiary referral center. Anti-HCV positivity was 1.8%. Only 70% of them were tested to HCV RNA. The HCV RNA positive rate was 65%. And the linkage time from infection identification to treatment, of course, became shorter these days, however, still very long, like almost 3 months. And the treatment rate was below 40%. These are the core indicators, even though it looks like we are going in advance. However, there are lots of things to be better. So in our hospital, we recently adopted a new reflex testing alarm C model, what they call real C model, to improve HCV care cascade. Briefly, if a patient is positive to anti-HCV, our laboratory medicine will do reflex testing for HCV RNA without repeated blood draw. Then if the test comes back positive to RNA, then notification will be delivered to the physician who ordered that test. And if a physician is notified by this alarm system, they should act as recommended and they should report what they did for this alarm. So when you analyze the effect of our real C model, the HCV RNA testing rate of anti-HCV positivity increased from 51% to 90% after the real C model adoptions. More important point is this figure, I think. Before this model, the HCV RNA testing rate was, of course, the highest in the GI department. However, other departments such as just minor surgery or even medicine, not the GI, was about 40% to 50%. However, after the real C models, all the clinical departments showed 95%. Of course, we did reflex testing, and then at least the testing rate was more than 90%. In addition, the mean interval from anti-HCV positive to HCV RNA testing markedly decreased from 45 days to just 1 day. And this system shows very encouraging results. So I believe other hospital centers in Korea also tries to launch a similar program like us, even though the detailed method would be a little bit different. Okay, thank you for your attention.
Thank you so much. That was an excellent overview. Really a great demonstration of the value of reflex testing algorithms in laboratories where the clinician does not have to be involved in ordering that second test to detect current HCV infection. I guess 2 quick questions, please, about reflex testing. Do you think that's become the routine standard now around Korea, or you think it's still just in certain facilities such as yours that have adopted it?
Thank you for the good questions. First of all, of course, everyone knows the reflex testing will be effective to identify the HCV infection patients. The problem is there's some administrative issues, including the payment, and then sometimes the patients concerned about why they did the test without their consent, even though they already got the consent before. So even though we set up our model very successfully in our center, but I do not think all the probably hospital can adopt this kind of system. But anyways, the from the big centers, lots of the hepatologists try to launch the similar system. Of course, the system might be a little bit different in terms of how many patients they are going to cover, and then how to ask the payment to the patient. So those are a little bit hurdles to successfully launch this kind of reflex testing system.
Mhm. And please tell me, just so I understand correctly, the status of routine one-time HCV screening for persons 40 to 65 years of age. Is that a decided policy or one that's still just in the proposal stage?
Actually, the pilot study I showed you earlier is actually our Korean Liver Society suggests to our government to see the effectiveness of a one-time universal screening program. And then it became very successful. And then we are continuing persuade our government to incorporate this time one-time HCV testing to the regular national health checkup. Korean people are provided free 5 major cancer screening program every 2 years. So our Korean Liver Society wants this universal screening program putting into the regular health checkup program.
Yes, that would be a great outcome. So that's still being requested, hasn't been accepted yet by the government.
Correct.
But we wish you the best on that. Thank you. Thank you very much. I guess just one quickly. I mean, I know you're, just as a clinician, for routine testing, and when someone's found positive, the person's in Korea. You mentioned that some sort of object to a reflex test, but overall, how do you think your patients respond to being tested and receiving treatment for hepatitis C in Korea? Are they surprised, or do they readily accept treatment? We hear sometimes people don't want to get treated because they don't feel that sick. Just wanted to see what was the situation in Korea.
Okay, so based on my experience, most of people, they usually don't know about what the HCV infection is. Most Korean knows hepatitis B virus, but they usually do not. They are not usually aware of the HCV. So if they were heard you got the HCV infection, they, like you said, they are usually surprised. I have no idea how I got the HCV infection, and even they usually say, I didn't know what the HCV infection is. So if the HCV is identified, if you just explain the disease and then everything, and then this disease can be curable, and they usually agree the treatment. And then in our report, the treatment uptake rate is about 90% after the hour model. Yeah, but the most important problem is as you expected, the price, the cost of the DAA. In Korea, the DAA treatment, even though it is reimbursed by the national health insurance, it's still expensive, like almost $2,500 US. So even though they got the infected and they are willing to be treated, but the copay is still high. That's one of the biggest hurdle.
Okay, thank you very much. Thank you again. Let's move on, just in the interest of time for I see Professor George Lau has joined us and has a question. George?
Yeah, it's really marvelous to hear all the positive actions in Hong Kong and Korea, which is the leading society in Asia Pacific region. I just wonder what type of DAs are being prescribed for those patients you tested positive. What is your policy, and how do you know it works? Because we have different genotypes, and sometimes it's not 100%. So what is the follow-up actions for those people being treated?
Yeah, Thank you for the question. So if they were diagnosed to have a HCV infection, the treatment regimen will be decided usually depending on their physician. I mean, depending on the hepatologist. In Korea these days, GP regimen and then the Epclusa, they are two most frequently covered used treatment regimen. So there's no big preferences. However, probably the hepatologist will decide which kind of treatment might be better for their patients, considering the comorbidities and then age and then everything.
Thank you.
Well, my question is, are you following up for those patients? Have you follow up on those patients? And what is the outcome of those patients after your linkage to care or service?
So actually, we launched this program just last year. So the thing I can report at this moment is like I showed before, just a treatment uptake rate and how many patients were linked from the HCV antibody to RNA test. But if you are saying about the long-term outcome of these patients, I haven't had any data so far. But after the treatings, all the patients were completely cured. Yeah, I'm not sure whether my answer is satisfactory to you.
That's what I'm asking. Thanks.
Yeah. Well, just quickly on that, I mean, it brings to mind when I talk to other clinicians that we see the long-term benefits of treatment in terms of reducing risk of liver cancer and progressive liver disease, but I also hear reports of patients feeling more immediate improvements in their health, more more energy, more sense of well-being. Do you have patients that have that kind of response to treatment, Dr. Choi?
Yeah, if we're saying about the short-term outcome, like you said, just normalizing the ALT, probably increasing the well-being sense. Of course, some of my patients have a similar experience. Let's say that if they are feeling a little bit fatigue without any cause, the ALT was sometimes fluctuated, they reported, but once they are treated, all the labs became completely normal. Some of the patients, their renal function is also a little bit improving. Yeah, those are probably the short-term outcomes that I have been seeing so far.
Thank you so much.